All right, ladies and gentlemen, we're going to actually go ahead and get started. We know that the day and the time is progressing, so we'll start a few minutes early and knock out our last session of the conference. I do want to share, unfortunately, due to unforeseen circumstances, Dr. Malik from Emory University was unable to attend and offer the sleep medicine talk. So we are doing this interprofessional education activity in place of her presentation. So this session is entitled Putting All the Pieces Together, an interprofessional education tabletop discussion. And so to set the scene, what we first want to acknowledge is what is IPE, or interprofessional education. It is intentional learning when two or more professions learn about, from, and with each other to enable effective collaboration and improve health outcomes as defined by the World Health Organization. IPE provides an ability to share skills and knowledge from one's experience between professions in a team-based approach, and allows for a better understanding, shared values, as well as respect for the roles of other healthcare professionals. Today's conference has certainly been comprised of a number of healthcare providers in the areas of nursing, advanced nurse practitioners, health educators, public health practitioners, etc. And so with this activity, what we want to do is give you the opportunity to reflect on the presentations that have been given on today. And we have 4 questions that we'll show on the screen. You'll also notice them on boards across the room, 2 on each side. And so we'll start with the first question. This question was inspired by the presentation given this morning by Dr. Larry Greenbaum. And the question reads, in what ways can pediatric telehealth influence changed behaviors and better health outcomes in rural Georgia families? And so what you're going to do at your table with the small group at your table is discuss this question, discuss some responses, and utilize the blue sticky notes on your table to write down your answers. You can each take 1 or 2 blue sticky notes, however you like to do it. But we'll give you 5 minutes to reflect and discuss this question, again, inspired by Dr. Greenbaum's presentation. And so I'll read the question again. We'll just follow this same format, going through all 4 questions. And then once we've completed this format for all 4 questions, we'll give you the opportunity to get up, get moving around, and place your sticky notes on each of the 4 boards with the corresponding colors. Okay. So again, question 1, in what ways can pediatric telehealth influence changed behaviors and better health outcomes in rural Georgia families? All right, question number 2. Question number 2, which is represented by the orange sticky notes. Question number 2, as inspired by the presentation given by Dr. Sarah Parker Jones and Dr. Melanie Morris, reads, how can barriers to utilizing resources for pediatric hearing health services be addressed for families across rural Georgia? Again, question number 2, how can barriers to utilizing the resources for pediatric hearing health services be addressed for families across rural Georgia? As inspired by the presentation by Dr. Stephanie Walsh, question reads, in rural Georgia clinical settings, how can the shift in the treatment approach to obesity prevent a pound up? In rural Georgia clinical settings, how can the shift in the treatment approach to obesity prevent a pound up? So it was asked to explain prevent a pound up. So in essence, prevent youth from gaining weight. What innovative methods for addressing pediatric patient challenges could be cultivated from the panelists' advice? What innovative methods for addressing pediatric patient challenges could be cultivated from the panelists' advice? I really, really hope that each and every one of you gained something from, this interprofessional education activity and experience. Though it was quick, it offered you the opportunity while here to start thinking, start brainstorming on, okay, how can I utilize this knowledge that these subject matter experts from today have poured into us at this conference? So now let me go back. First, let me ask that you all would clap it up for yourselves for participating in this activity.